Society of India has already come up with the guidelines in 2023 for the management of dyslipidemia, and they say that first you do a non-fasting lipid profile, start with HTMB with rosuvastatin 40 or 80 atorvastatin with HTMB. If you cannot achieve the LDL to less than 50, 55, add bempedoic acid. This is at the end of 4 weeks. So you start with a 2-drug combination. End of 4 weeks, you add bempedoic acid. If you're still not able to achieve the targets, then wait for 8 weeks and then add a PCSK9 or Inclisiran so that you can achieve the targets. But if you ask me what would be my strategy for it, my strategy would be start off with a high dose statins with HTMB and give one shot of Inclisiran and the first go, especially for these high risk patients, because we know that these high risk patients, there is no point in waiting for 4 weeks or 8 weeks. The issue is that we have to get it as low as possible and as early as possible. So the Cardiovascular Society of India guidelines states that you have to do a stepwise treatment, first by a statin and HTMB, then add a bempedoic acid, and then think of an Inclisiran if you have not reached the targets. But in my own practice, I've seen many patients do not tolerate this algorithm. They either have hyperuricemia, they have SGPT, SGOT raised, and this is where we lack, because most of our patients, we don't do a liver function test at the end of 4 months, the end of 4 weeks, and that is where we miss. Or if you put them on bempedoic acid, many of our patients come with pain, joints, etc. We do not do a uric acid. So we have to be very careful about the side effects and accordingly start thinking of giving Inclisiran. Now, if you see the heterozygous familial hyperlipidemia, definitely this is a drug that is to be given, and this has been approved along with PCSK9 inhibitors also. For secondary prevention, Inclisiran in the fasting LDL is more than 2.6 millimoles per liter, despite maximum tolerated lipid lowering therapy. And what do I mean by maximum tolerated lipid lowering therapy? It depends on individual patients, whether they're tolerating statin, STB, or bempedoic acid. Now, the ACC consensus has also recommended for ASCVD and this thing that is familial hyperlipidemia. This molecule is one of the best molecules where you can give a 6-monthly dose, especially in those patients who have not developed their complications due to familial hyperlipidemia. And also in high-risk ASCVD patients, these patients have to be given Inclisiran as soon as they have an acute event.